for the few minutes of being late, but you know what happens when you have technical difficulties. I am Stephanie Van Bark, and I am a small business owner. Thank you for joining us again today. The young lady that is joining us today is Dr. Candace Drummond from Avid Group of Companies. And I always say this, right? I'm really excited about talking to this young lady just because she reached out to me and I had a chance to kind of talk to her a little bit about what she does. And it occurred to me, I'd never heard of this industry before. So I didn't really want to ask a lot of questions because I want to learn and be as curious as I'm sure you will be as you're watching as well. So without further ado, I would like to introduce Dr. Candace Drummond. Welcome.
Hi, Stephanie. Thanks so much for having me.
Thank you for joining me. The minute she called, I was like, oh yeah, we got to talk about this because this is an industry that's really new to me. And especially during this time, I would imagine you're super busy, but let's learn about some of the adjustments you've had to make while you were in business. I will start with, who are you and what do you do?
Well, like Stephanie said, I'm Dr. Candace Drummond. I'm a clinical psychologist and licensed mental health counselor in Florida. I started Avid, which it was actually Avid Intellectual at the beginning, was just was supposed to be really just my private practice. I just gave it a name. It's actually based on my daughter. It's her initials. And so I was like, all right, here we go. I'm going to start my private practice. In less than 18 months after I started, my practice actually grew to more of like an agency that covered 7 Florida counties and had 13 offices in the state of Florida. I have now about 20 psychologists that work for my company. And I have actually, like you said, I have pivoted in the last several months because previously most of our contracts were government contracts. They were with Department of Education, Department of Health, and I don't know if you guys know, but a lot of those offices are closed. Nobody's going into DVR office, nobody's going into a disability office. All of those things are closed right now, and so our referrals, I think we saw about an 87% drop in revenue.
Wow.
And yeah, that's incredibly significant.
Wow. So talk about having to pivot.
And so
can you catch that up? Let's ask that question.
Yeah, it was like, do or die, kind of sink or swim,
Exactly.
What I recognized was that large healthcare facilities like the VA, large healthcare facilities don't refer out. They don't refer out their services. Like if they get a contract, like the VA, again, was a healthcare facility, all of a sudden they got this huge contract from the government for mental health provision. Are they going to be like, oh, we don't need that $7 billion, refer it out to this mental health agency over here? No, the VA is like, go ahead and give it to us. We'll take care of it. We'll contract that out to some providers in the area, in a community, whatever. We'll take care of it, and we'll keep a piece of that for administrative costs.
Right. And before, were you providing those kinds of services for an agency like that, and that's just happened within the last pandemic?
Well, I mean, the fact of the matter is, I mean, with internships and with all of the stuff all the free work that we've done to get our degrees, we've all worked in some kind of agency of this sort.
Okay.
Some kind of hospital turned mental health clinic, some kind of community outreach turned mental health clinic, so again, they're not referring out these services.
Okay.
If the funding is available for these services, they're not referring out.
So
they're contracting out.
So let me ask you, I did read a bio, a company profile, and a press release that she provided, and I was like, okay, that's it. That's all I want to know. But I guess I was trying to assess, are you more of a business development company for healthcare providers, or are you a staffing agency for healthcare providers, or both?
Both. It's
Okay.
really, we not only help them to expand their service provision by, again, like allowing them not to refer out. Any private practice can incorporate mental health and psychological testing services into their existing practice at no cost on a fee-for-service basis
Okay.
with us. So not only do we expand their service provision, we actually are able to negotiate higher rates for
Okay.
services, for reimbursement through insurance, because now they're a multidisciplinary practice.
Okay.
We're able to provide the staffing and vet the staffing for all the mental health and psychological evaluators. We provide supervision for all of the people that, again, are in this, so it's no additional management duties. So again, a lot of times the doctors are like, well, I don't want to take this on because now I've got to manage this whole new team that I don't necessarily know anything about. Like now I've got to study mental health. I've got to study psychological testing. I've got to understand the coding. We take care of all of that.
Now, you talked about losing 87% of your business. Does that mean you lost your clientele, and as a result, you are securing or targeting a new market? How does that drop? And was that because you were connected to health agencies that were larger agencies that are now getting that kind of funding?
Well, what happened actually was at the end of 2019, I had actually done a kind of business review on my own agency.
Mm-hmm.
And I realized that the cost of acquisition for customers through these government agencies that we were going after, we were going after Department of Education, Department of Health, but the cost of acquisition of those was actually very high because it's a deep pool. There are lots of little people like me trying to get a piece of these contracts.
Absolutely.
And so I had actually made the pivot to target the smaller healthcare providers and allow them the opportunity to act like the larger agencies. I had actually made that pivot in January, and we actually began to acquire partner practices, and we have about 2 or 3 partner practices right now. But then, the world stopped.
Right, exactly. But I mean, I would imagine during this time, I was sort of thinking about what could your emergency plan be? I mean, typically, we're talking hurricanes here, around other parts of the country, other weather conditions. So I would imagine you could continue your services. A pandemic is a perfect time to reach out to a small agency, but do they have the time and the energy to sit and pay attention to what you can provide?
Well, what I've actually done in order to, again, try to combat that, I've started a Facebook series where I interview and showcase private practices of all kinds.
Okay.
It's called Put It Into Practice, and it's 8 p.m. on Thursday nights, 8 p.m. Eastern. And the private practice gets free publicity.
Right.
They get an opportunity to showcase their offers, their services, how they can better help the community. They can attract new virtual customers. They can talk about how they pivot, as well as hear my plug and my ability to actually help them expand even during this time. And also, it has. We have about 50% conversion rate.
Good. That's good.
Yeah.
You're working to get it back. You find it.
Yes. So, and it's actually better for us in the long term as well, because this also allows us to let go of some of the issues that we had before, which were like having a building space. Like I said, I have 13 office locations in the state of Florida. Almost all of them were physically forced to close.
Oh, wow.
About 4 of them are just moved to telehealth.
Okay.
So
yes.
the office space is available, the staff isn't coming in.
Yes. Yes.
And so now, like I said, with partnering with these other practices, we don't have the problem of space anymore because we practice inside their practice.
Right. Okay.
Whatever their model is, whatever their setup is, we practice within their model.
Okay.
We white label everything. We become one of their practitioners.
So you put a practitioner in their office and they essentially work for that office.
Practice. Correct.
Very cool. Very cool.
And we allocate staff too. So like, even if I get this question all the time, what if I don't have enough psychological work or testing work or whatever for somebody to be in my office every day of the week?
Mm-hmm.
I mean, and that's also fine too, because remember, we work on a fee for service basis. So we'll put a provider in your office for 1 day or 2 days, whatever you've got, and we'll allocate that staff to another practice for the other days. Gotcha. And all of that. So again, you don't, as a practice, you don't have to worry about having enough. We make sure that that is handled for the provider.
So what tools are you offering right now for this new clientele? Because you're right, this is a new space. I was telling people about a month ago, I did a physical over telehealth, which was new.
Here.
I know.
Is it soft? Is it soft? Is
it? I don't know. I don't have expertise for this. Nobody made me a doctor. But I'll take your word for it. It doesn't hurt. That's all that matters.
Yeah.
So it's a different thing, and I've marveled at how almost everything has gone onto this online platform. So are those the types of tools and other measures that you're able to bring to the table for service providers or healthcare providers right now that really excite them and want them to get on board with you? What are some of those tools and ideas and recommendations?
Well, I mean, most of the medical providers already have an electronic health record that they work with, an EHR, or even a telehealth platform, Zoom for practitioners. Doxy.me is also a very, very common one within the healthcare community. What I actually bring is more of the knowledge and expertise. So I'll give one really great tip that I always give. Physicians right now, a lot of the times, if you're not doing a physical teleconferencing visit, you're not being reimbursed.
Okay.
All right. And for physicians, especially physicians with older clients or older patients or people that, just not super tech savvy, they're not necessarily able to provide the kind of case management that they need to, medication management, checking up on symptoms, all of that stuff, because they're not getting they're getting zero reimbursement if they talk to them on the phone. However, that same practice would be reimbursed at over $100 per hour if the same phone call, were made by a licensed clinical social worker.
Oh. Okay, so you help talk money.
Thank you. Not only money, but freedom of time, freedom of delegation, and also being able to assist another person in becoming employed during this time.
That's actually an amazing concept for sure. And you were already in that space. It's just a matter of now really targeting and going into a new market.
Yeah.
Wow. Are you finding it difficult to connect with people at this point?
No, not at all. I mean, the doctors, once they hear about free publicity for their practice, are really into coming onto the show. And that allows for me to create the relationship and even start from there. Even if they don't decide to partner with me initially, they're very intrigued by the concept. And they stay in contact and they hear about, how is it going? How are the other practices doing? All of those kinds of things. Like I said, this same doctor that was working 80 hours a week, getting zero reimbursement, trying to do the best for his patients, can now sit at home, hire someone else, pay them half 50% of the reimbursement rate, which is high in the industry for a licensed clinical social worker. And again, somebody's hired, somebody gets to relax and delegate, and the patient gets better care because the social worker is actually more in tune with what case management needs to be, especially if done over the phone or via telehealth.
So how did you get into this? Was this an industry that already existed within our healthcare profession, or you just came up with this bright idea and ran with it?
I just kind of saw a hole. Like I read an article called the blue ocean, red ocean theory of marketing.
Mm-hmm.
And the example that they used was Uber. When Uber first came out, the ocean that they were trying to get into would have been very crowded, the taxi market.
Mm-hmm.
Taxi market was a red ocean. Everybody and their mama that had a car and could get a hack license would go out there and try and become a taxi. Fair enough, but it was a red ocean. What Uber did was get into that very same market, but do it in a totally different way that allowed them to be the only fish in their pond.
Okay. So look, that's business 101 right there.
And so that was what I looked at. Like what I looked at is like, okay, well, I'm fighting with all these other agencies for this little piece of a government contract.
Mm-hmm.
And all of these doctors' offices out here are giving away money because every time that they have a referral, and again, they're not necessarily doing it correctly for the patient because they're concerned about losing their patient to this other practice. Right. They're concerned about, referring out and and losing their patient. So again, they're a little bit, okay, they refer out when absolutely necessary.
Right.
Not on every single case and every time that it would be best for the patient. And so if we can allow them a way that they don't need to refer out, we close that barrier that now they have this thing incorporated. And again, no additional management. So it's not, again, that they have to now go out and study this whole other field of medicine. So we take away those two barriers. We increase revenue. We increase patient retention and attract new patients because, like I said, once we put on your insurance panel that you're a multidisciplinary practice, they actually advertise you more to the patient, to the patient.
Right.
So again, you attract new patients. You have less work because now you're delegating out all of this additional stuff, and you have like I said, this stream of revenue that just pretty much
added more to what you're doing. So are there other areas in the healthcare providing system that you could apply this same model to? Have you thought of doing so and adding more, for lack of a better way to put it, products?
Absolutely. The beauty of mental health services is that it covers just almost anything. At this point, we have psychologists, licensed mental health counselors, applied behavior analysts. We have nutritionists. We have dietitians. We have acupuncturists. We have Reiki masters. We have, so like you say, as far as incorporating all of these additional services that now can actually be claimed for through insurance, can become a consult along with like your OBGYN.
Right.
We are able to now add in the therapy services for postpartum depression. You can also add in acupuncture for the pain during labor. You can also add in chiropractor for for your back after. You can have masseuse for deep tissue on day of day of labor. We have
you run the gamut. Wow, that's very interesting. So do you do the sales yourself, or is someone else? Do you have someone on staff that's kind of really attacking the market in that way?
No, I mean, for right now, like I think sales is a wrong word. Okay. What I do is a partnership.
Okay.
Because no one pays. It's a fee for service basis unless if they don't see any patients, there's no cost for what I do.
Okay.
What I do is, set up and create the partnership between my company, their company, And like I say, it can evolve over time. It can grow. It can shrink. It's very, very flexible. And so I don't have anybody else. It is just me.
Okay.
I am thinking about it, but it's difficult because it's difficult for other people to really grasp and be able to understand and explain the concept in a way that attracts other people, because it's very new, it's very novel. A lot of people are kind of like, so how do you do that exactly?
Explain that to me again. Is that going to cause me some problems in the long run?
Like, what are the codes for that? How do you know?
I can imagine because the healthcare is definitely one of those. I'm intrigued by that industry, but I don't think I'd ever be really good at it. Were you in a position to apply for any of the loans and grants out there?
So yes, I applied for the emergency disaster EDLI or the so initially when I had applied, it said that it was a $10,000 advance, and that there would be additional loan offers, later on after the initial advance. However, over the course of my application, the wording seemed to change on the site.
Yes, there was. Did you know it? Did you find out later?
I found out later.
Okay.
And so then it changed to up to $10,000 advance, $1,000 per employee, and then no real mention of the additional loan funding anymore. It just, that was it. It was just the advance.
And did you have employees or your contractors, the people that you were with are 1099? Yeah, that happened to a friend of mine. It's like, yeah, it's been a special process for small businesses.
Because the truth is, had I gotten the $10,000, the plan that we had in place was already to close many of the physical offices, but also to actually, pay the rents.
Yeah.
So that the landlords we could close out the leases.
Right. Absolutely.
The right way. That has not been the case. The majority of them, we've worked out deals, and the landlords have been gracious enough that they've let us use parts of our security deposits and things like that in order to end and close out our leases and pack up our places and stuff like that. So, but there are several of them that are still waiting. We've made. But payroll is, again, significantly less than it ever was.
So when you look down the road, you see, and it sounds like you have a very good pivot plan, and that you are prepared to really make it to the other side and then really soar. Because with mental health, there's been a lot of conversation about how this pandemic is going to play on on society mentally for years,
decades. Yeah,
right. I mean, and history has demonstrated situations like this that's bared out. So I see a great deal of opportunity, but are you struggling to get to the other side to get that opportunity? Or are you starting to chip away at it slowly?
Well, yeah, I mean, because of some of the strategic decisions that I've made as far as letting go of some of the physical spaces and reducing some of our staff, we have been able to get a telehealth contract from Department of Health. So disability will be beginning telehealth June 1st.
Good.
So we'll get a steady stream of appointments from them starting then, and the staff that's in place are prepared and ready already. We've already done the attestations and the trainings and all of those things that are required for us to be eligible to provide those services once they start scheduling. The admin staff that I let go or furloughed, Part-time admin staff I furloughed, she will begin again on the 25th to start receiving those electronic records and documents, support documents from the state to disseminate to our various staff.
Okay.
Okay. So because of some of those changes and because of the online series, which I'm also going to be putting the audio only into a podcast of the same name that I will release weekly as well. Because of those things and gracious hosts like you that allow me to come on and talk a little bit about what I do. I do think that the attention and the interest will continue to grow, and the physicians, like I said, the medical practices that are out there that are watching all of their patients need mental health care are not gonna want to just let all that money go.
Right. Absolutely.
It's the reality. We have to keep talking about the bottom line because these practices are also struggling to stay open.
Absolutely.
Because they've been closed for 6 weeks, 8 weeks, 10 weeks. They're again, like I said, they're getting reimbursed at a much lower rate, or if at all, if they don't know how to incorporate the mental health, because mental health is getting reimbursed by insurance for the first time in history. Telehealth consultation was on telehealth because I knew this was the way that it was going to be going. I didn't know it would take a pandemic, but I knew
it was going in this direction.
Insurance eventually would have to get on board. Payers would have to get on board because it allows for the reach to be so much greater than they could ever do on their own, ever.
Very cool. Okay, so I'm going to switch scripts a little bit. Also, reading your bio, I understand you're a serial entrepreneur. You have started something in partnership called Momscapes. Did I say that right?
It's Momscapades.
Momscapades. Okay, see, I got it wrong. But I'm not a mom. I thought it was a brilliant idea, actually. So tell us a little bit about that. And we'll delve into that a little bit as to how this time has presented a challenge in that state.
So yes, I am a single mom, but I love to travel. And even since I've had my daughter, she'll be 4 in 2 weeks. And she already has probably about 6 stamps in her passport.
Awesome.
She got her passport, by the way, when she was 4 weeks old. And we took our first trip when she was 8 weeks old. We went to New York to visit, the Liberty City or whatever it's called, Statue of Liberty. My goodness, I travel so much.
Liberty City is a little bit.
Liberty City is down here, right?
Liberty.
But no, we went to New York. We went to the Bahamas, which was like 4 months old. We've been to Paris. We've been to Jamaica 3 times. But what I realized very quickly and very easily is that there's really no place for single moms in travel. Because I recognize that, back in the day, back in the 50s, single moms were working 5 jobs as a waitress just to make ends meet. But the reality of it is that many of us now are doctors, are engineers, are lawyers, are business professionals, but there's no place for us. And we have a $1.63 trillion spending power. 67% of the mothers in the United States are single mothers.
Oh, wow.
67%.
Wow.
So the fact that there's nothing for us just is mind-boggling. Because as a single mom, you go on vacation with your kids. It's just being in another place with your kids.
Right.
It's not vacation for you.
Right. Exactly. Because you got to
let's be real.
You still got to make sure the kids are entertained. Exactly.
You still got to wake up with them. You still got to, like you said, feed them. Even if you're taking them to the dining hall or whatever, you still got to make sure that they're safe, entertained. You're not having a vacation.
Absolutely.
And
Absolutely.
so a lot of single moms forego that altogether because, like I said, what's the point of spending the money just to be in another place with your kids?
Mm-hmm. Okay.
And so what I did was again, brainchild, an idea of childcare actually being built into various resorts and various trips and various places around the world. And so what I'm actually beginning now in the next 2 weeks, 3 weeks, I'm actually going to start traveling with my daughter.
Okay.
And I'm actually
Really?
Yes.
Okay.
Yes, I
I'm not there yet. I'm
know.
not there yet. So that's brave. That's brave. That's
I
brave.
know.
Brave.
But yes, I am. I'm going to. There are lots of places that have the less strict travel restrictions right now. We are going to start with driving. We're not going to, start flying quite yet. But there are, several places that I want to see and I want to go to, and I want to take her. I mean,
Now, does your travel experience, it's arranging the travel package, or are you also responsible for the child care at the various facilities?
so what I've done is I've actually, again, my relationship, I like partnerships. What I've done is I've gone anywhere that I go and I stay, I talk to and work out a contract with the local childcare providers in that area to provide services for that hotel or resort.
And that's a part of the package.
And that's a part of the package.
Okay.
And so again, everybody gets paid. The hotel gets a 10% or so to be exclusive with this childcare provider. The childcare provider retains 80% in order to pay their staff, do the background checks, make sure that they make sure everybody is safe around the kids.
Right.
And I get 10% for making the relationship.
Very cool. Okay, so you got revenue streams coming in. I would imagine right now that has sort of been on hold, but once you start to travel, then maybe that will start to pick up. Or has it? Have you found people still want to travel and they're still ready?
They're still ready. They just don't know where to go, where's safe, how can we get there? What are the things that we need to do once we're there? Those kinds of things. And I feel like I have a pretty good grasp on those things.
Okay.
One of my bachelor's degrees is in biology. Granted, I'm no epidemiologist. I am no doctor in that field.
Let's be clear.
It does allow me to just kind of better understand how viruses function,
Right.
and as a result, just kind of be able to better protect myself and my daughter. We've been, really healthy. We've been by ourselves for the most part for the past several months, and we've been driving back and forth. Like right now, I'm in Boynton Beach today, but in the last couple of weeks, I live in Atlanta. I was in Key West 2 days ago. I'm going to Fort Myers this afternoon. So driving, I mean, as far as I know, if I don't have the virus and I get into my car that didn't have the virus inside, there's no way for it to get there. Like, I'm the only one in there. So,
exactly. So I'm definitely safe in that realm. As long as it's not in my car.
I'm the only one that got in there.
That would be the same as going to the grocery store.
Exactly. And so, it's just a longer drive. I just, I'm thinking that our first stop is probably going to be Hocking Hills, Ohio. They have really cool luxury tree houses.
Oh, nice. Very nice.
Right.
So does she understand that she has a passport that's she's flying all over the world, or for her it's just about it's fun when I get there and I'm with mommy?
I don't know what her level of understanding of it is, but I know she says she loves the airport.
Okay, good.
She loves the airport. She loves to fly. And when she talks about places that she's been, in her mind, they're all in the same place. So she'll be like, let's go back to the place with the bridge. And, in her, to her, that's just the place with the bridge,
Right
but
down the street.
it's actually Portugal, like what she talked about the boardwalk that we were walking down in Portugal. And it's like, well, maybe we can't really go back to the bridge right now.
No, it doesn't quite work like that. Doesn't work like that. So
But
do
then
you
she
provide
also
travel?
say, I want to go to my house in Atlanta. Because
Oh,
like I want to go to my house in Atlanta. I'm like, so she has some good concept that we do move around, and that we have a very nomadic lifestyle,
mm,
and she very much likes it. She very much.
very cool. Very good. So do you do packages also for couples, individuals, or is it, just single moms, which is great. I actually think that's a great concept for sure.
It's single parents.
Single parent. Okay.
So if you've got a partner, or if you're a couple, the family packages already exist. You can
Okay.
go to cheapcaribbean.com. You can find the family friendly resorts. You'll find
Mm,
the basic kids clubs. Those kinds of stuff. Those already exist.
okay.
The problem that I found with the kids clubs, like I said, I travel a lot, is that a lot of the times they have like lunch breaks or things like that. So
Mhm.
they'll expect you to come and pick up your kid at
Oh.
lunchtime, or something, and it's like, well, when am I gonna nap? Like, when am I gonna go out on my jet ski? Like,
I can't take a 4-year-old.
right? Like, what am I? This is
Not
still
on
not
the
really a vacation. Like, what do you?
jet. No, I get that. I get that, and it's so funny because I think that's brave, really, because there's always sort of this concept that you always want to travel with your kids. But I find it funny that during the pandemic, this concept of parenting has become it's different now. You know what I mean? When you're 24 hours around your kids, I see a market for you for sure in the summer, because my friends about ready to put their kids out on the stoop.
I'm telling you, like, go outside, play in
Go
traffic.
stay out there for a minute. So you definitely have some potential there. I see it. I see it. I see it. Well, thank you so much for agreeing to have a conversation with us. I learned a lot, and it's funny. I'll show you. I had this big old list of questions, most of which I went off script because you say something. I was like, wait a minute, say that again, explain that again. So I hope it was a wealth of information for everyone else. A quick announcement: tomorrow morning, I know Dr. Candace is going to be on Wake Up Miami with Andre Williams and I'm sorry, I'm getting her name. Do you Lachelle? Is it Lanice Rochelle? And they are towners. They actually are in the Overtown community. So great shout out for them. They have a Wake Up Miami show every morning at 8 o'clock. It's wonderful. It really gets you moving for the day. So definitely check out Dr. Candace tomorrow and all shows after. Always got to support our towners, and let's see if we can get them on our show pretty soon. So thank you again. Before we go, can you tell us how to get in touch with you, how to find you?
Absolutely. I'm on Facebook. Dr. Candace Drummond is my personal, or you can find Avid Intellectual Inc. Or Avid Wealth, which I didn't even get a chance to talk about it.
Wait, no, then go ahead. Actually, stop. Hold on. Go and tell us about wealth management, because we want to know it all.
That's the Avid group of companies now, because Avid Wealth Management actually bloomed out of my desire to understand money. And so not only as a business person, but as a human. And so I have an insurance license and a financial planning certification as well. So I also assist the doctors in again, insurance. So business insurance policies, director's insurance, key man insurance, disability insurance, like what happens to your practice if you're not there.
Okay.
Like a lot of these sole practitioners, like what happens? Do the lights stay on
Right.
at your practice if
Right.
you're not working? So again, we have business overhead insurance. We have, again, all of these annuities, again, that we can put together in order to save up for expansion projects, to save up for personal projects, to save up for, college for your kids, all of those things that we can find at 15 to 22% interest rates. Nothing close to what a bank can offer
Right.
you.
Right.
So it's, again, that just kind of bloomed out of my desire to the strategic planning and development of these different private practices, the things that I've learned for myself and I've been able to implement that allow me to kind of be able to decide I'm going to travel for the summer with my daughter.
Right. Exactly. I'm going to get there. I am. So my question, hey, we got some people checking in. Great information. We'll share with single parents. So Ava Branham Lampkin said that. So yay,
Yes.
you got some sales.
Because yes, we have all of our packages have a minimum of 8 hours of built-in childcare, or you can upgrade to a 24-hour package where literally you check in and your kids check in to their vacation.
Okay.
And y'all meet at the end.
I'm telling you, I see all of a sudden everything's going to flip to the travel thing. So, I think this is good. This is interesting.
Yeah.
But it feels like with Abbott, you're a one-stop shop for a healthcare provider that wants from nuts to bolts business development opportunities to include financial opportunities for themselves and the growth of their business.
Yeah.
So there's just no reason why not to call you.
And it's also to improve their work-life balance. I mean, like, honestly, I think doctors work too hard.
Mm-hmm.
I mean, I'm not gonna lie. I mean, burnout is rampant. They work too hard. And a lot of the times that is because, they feel like everything has to be done by them. Mm-hmm. And it doesn't. We can delegate, actually get more income by delegating and allow for more freedom in the long run. No one in my company works or is in any office more than 3 days a week. It is a rule. You cannot be in the office more than 3 days a week because otherwise your life sucks.
And right now, as you mentioned, during the pandemic, we're going to see a lot of that change, good, bad, and indifferent. Just outside of the healthcare provider world, I've talked to a lot of entrepreneurs, and they're all sort of changing their perspective on their work-life balance. So this is the perfect time to make that shift, but still to pivot in a way that allows you to continue to sustain yourself as a company and to stay alive. So
thank you
so much.
Contact me. Sorry, we were there. Avid Intellectual Inc. on Facebook. Avid Wealth Management on Facebook. I'm also on LinkedIn. You can find I think it's Candace Drummond, PsyD, LMAC, all the letters. You can find me on LinkedIn. And Momscapades is also on Instagram and on Facebook. So again, Momscapades, it is targeting moms, but like I said, single parents in general. Nobody wants a vacation if it's not a vacation from their kids.
Absolutely. I'm not a mom. I've been on one before. I understand exactly what you mean. So thank you again. And we definitely have to keep in touch because I'm very intrigued by how you're going to be able to really pivot this. And I see the success. I actually see the success. So, and I'll definitely support it any way that I can. And it's been wonderful getting to know you for sure.
Thank you so much, Stephanie. I know we went way over, but I really, really appreciate the opportunity to talk about this and help as many people as I can, because my personal motto is, it's my pleasure to help. That's what I do.
Okay. Thank you again. We'll talk soon.
All right.
So thank you, everyone, for chiming in. I loved that interview because, as I mentioned, I wanted to learn right along with you. So it was very intriguing to learn some stuff and got some ideas, not to get in the healthcare industry or anything like that, but maybe some stuff I can implement and incorporate in my business and pivot in a way, which is, as we discussed, kind of what this show is really all about, was also me pivoting. So it is very much in line with that plan. Tomorrow at 10 a.m., we will be interviewing Gary Harris from Alpha One Staffing. So I'm very excited about that interview. I think we'll learn a little bit about the employment employment, the effect the pandemic has had on the employment or in this country, and how a staffing company might be very essential right now and beyond once we get beyond this challenge. So again, tomorrow, 10 a.m., Gary Harris, please tune in. And thank you again for joining us today. You have a great day.